Hello, I'm Dr. Arnold Hopland. I've been in Carter County for the last, since 1980. Came here to practice emergency medicine and spent approximately 8 years doing that at Sycamore Shoals Hospital. Worked with the rescue squad and am still currently the 911 medical director here in Carter County. When I left the ER, I wanted to start a family practice doing what I consider called barbershop medicine. You walk in, look around, and if the waiting room's full, you go do some shopping and come back later, and no appointments necessary. And my practice as a solo practitioner in family practice operated that way for several years until managed care arrived and demanded that patients select a physician. Because my main commitment was to be available, I stayed open from 10 a.m. to 10 p.m. 6 days a week in those days, and I stayed till everybody was seen that needed to be seen. To mix both availability and high quality medicine takes a strong focus, and so we had to add some additional help, and I was blessed with two boys who enjoyed the prospect of practicing medicine, and both Kenny and Jeff joined me in our practice at that time. We built a small office on Elk Avenue, 1900 Elk Avenue. It used to be the Green Tree Restaurant. And then we put a lean-to on the side, put a lean-to on the back. Then we built a two-story addition on the back. And finally we realized that to make the barn bigger just by adding lean-tos is very poor design practice. So we moved here to 1500 West Elk Avenue, where there were 7 acres under roof. We tore down about 5.5 or 6 acres of it, but we left 130,000 square feet and developed the office here where we could have a complete lab, x-ray, nuclear medicine, mammography, and all the services that are normally needed. One of the prime goals we've had since I first came to town was, number 1, to be available, number 2, to practice competent medicine, and to stay true to a pledge I made as I left medical school. We were all asked to raise our hand and pledge. First, do no harm. And to teach your craft to your son. And I have 2 sons who have learned everything I know, and then some other besides, so I don't compete with them any longer. But we've developed a quality practice. As we added more and more people to make the commitment to be available a valid commitment, communication became very important, and so we adopted electronic medical records approximately 23 or 25 years ago, first in this area. And this system of medical records has been continuously updated and is at the top level of certification. But it allows us to practice very consistent medicine. When one person cannot be available all of the time, someone is available almost all of the time. But we've been able to maintain that practice of being available on the day that you need to see us. We are especially grateful to the folk in Carter County who have supported our practice and made this beautiful facility available and possible, and continue to maintain it even as we expand further and further. Most recently into orthopedics, cardiology, we've had it on board. We've got gastroenterology here, and we look at other specialty activities which may be needed from time to time. But our primary focus is family medicine or primary care. And whenever a specialized service is needed, we have a department who is very familiar with those in this area who practice all of the specialties, and you will be referred to someone who has specialty capabilities. And so we do our very best to provide quality care at the most reasonable cost that we can function with. Back in '88, when I first started the practice, my charge for every office visit was $11, and I didn't take any insurance. Paperwork was easy. I liked very few regulations. Now with managed care contracts and other business requirements, we have a management team who very carefully evaluates our expenditures and tries to maintain the cost of medicine in our facility at a reasonable level. When we say that we would like to first do no harm, we are in the midst of an opioid crisis, which is literally causing thousands of deaths daily in this country. And right here, East Tennessee, Eastern Kentucky, Eastern Georgia, across to the Piedmont, is the highest concentration of this crisis. And so in order to address that issue, amongst other things, I've been working with state legislatures on ways to control misuse of opioids and yet have compassionate care for people who have pain and suffering. And we believe that there are ways to make the situation better, but anyone that has a solution to this problem clearly doesn't have a grasp of the problem. The problem is multifaceted and complex, and we have to be careful that we don't throw the baby out with the bathwater if we try to make changes in the way we practice medicine. That we have a staff who provide state-of-the-art care, and I'm proud of all of this group of folk, and I'm especially pleased with the kind reception this community has given to our practice. Thank you very much for supporting our practice here, and if you see ways that we can serve you better, we really are anxious to hear about it, and we will make an attempt to improve our services, because we know improvement is always available. When I see you about from time to time, although I'm semi-retired, I'm not sure if I am or not, I come in and see patients, but I am not taking appointments, but rather trying to take the load off a time when there's a long delay from a lot of patients who come in unexpectedly, and we don't want you to have to wait any longer than is absolutely necessary to get the job done with quality care. Thank you again, and when you see me from time to time, come on and talk. If you want to know about my childhood, I wrote a book, Sir Lancelot. It's about a 5-year-old kid in northern Wisconsin. It's not autobiography, but most of the events in that book have a basis in real life experiences, which are kind of fun. We'll look forward to seeing you from time to time. Have a nice day.